Yes, no, okay. Hello, good afternoon, everyone. I would like very much to welcome all of our guests on behalf of Clay Marsh, the Vice President and Executive Dean of Health Sciences, to this very special investiture ceremony today. This professorship is in memory of Dr. Anthony DiBartolomeo and was made possible by the support of over 200 donors, including friends and family who knew, respected, and honored the man. Dr. Anthony DiBartolomeo was a professor. He was the section chief of rheumatology for a period and an administrator and a leader of many initiatives and programs here within our academic health center. However, job titles and lists of accomplishments don't begin to describe Dr. DiBartolomeo or Tony D to his friends. And he had many friends. He was the kind of doctor everyone wants for themselves. Expert knowledge and ability for sure, but also very caring and compassionate, with a gift of making the patient feel that he or she had his undivided attention and concern for their health. My husband, who as a medical student rotated through the clinic, told me several times that he has never seen a doctor any better with patients and with the ability to foster that one-on-one relationship that promotes a culture of hope and confidence that things are going to get better and healing is possible, which is vital to the practice of medicine and to the service of humanity. Tony D was also a great friend to his colleagues. Being a physician is rewarding, but it can be stressful, and the pressure to help others can take a toll on even the strongest personality. For a lot of his colleagues, seeing Tony D could make you feel better. He looked like a doctor who enjoyed his work, and he was always glad to see you. Physician, teacher, role model, administrator, veteran, husband, father, and son. It was a privilege to know him, and altogether fitting that we come together today to recognize and remember him through the awarding of the DiBartolomeo Professorship in Medicine to a most worthy candidate, Dr. Nate Lerfall. So now I would like to introduce Dr. Judy Charlton, the Chief Medical Officer and a Professor of Ophthalmology and Visual Sciences, for some remarks.
Thank you for including me in this ceremony. This is very special for me because these are two of my very favorite people. I got to know Tony DiBartolomeo when I was a third-year medical student. Back then, he was doing his impactful research on methotrexate toxicity of the liver. At that point in time, we knew that methotrexate brought a lot of relief to rheumatology patients, but it was being underutilized because people were worried about liver toxicity. And he did the groundbreaking research to show that it wasn't as toxic as what we thought. Now, back in the day, having a liver biopsy warranted an inpatient admission. So we were admitting lots of patients for a liver biopsy, and that fell to the third-year medical students. So that's where I came into the picture. But Tony was a wonderful person to work with. Later on, we worked together on UHA board issues, medical staff affairs, and graduate medical education. And no matter what Tony did, he was respected, loved, trusted, and admired. He was an effective clinician, researcher, teacher, and leader. He had a very special gift that he could take a difficult, complex problem and manage it with grace. And he could inspire people to see things in the right light by using things like humor and a kind of common sense that was a bit like Jimmy Stewart. Now, Tony did have one edge to him that I always appreciated. He and I both were basketball fans. And when I started going to games at the Coliseum 40 years ago, I obviously started in the student section up in the peanut gallery, but you could always hear there was someone in the Coliseum with a booming voice that sounded a bit like Barry White, who loved to berate the referees. And I never knew who it was until my seats got better over the years. And finally, I realized that that was the voice of Tony DiBartolomeo. So I found a new dimension to Tony, the quiet master of difficult situations with medical staff affairs versus Tony at a basketball game. Now to fast forward, about a year and a half ago, we decided that we really wanted our institution to have a culture of quality. We didn't want quality to be a reporting structure or something that you get paper about, but we wanted a culture of quality that we live and breathe and is tangible on the floor. And we wanted to embed a physician leader in the quality department to help us make that happen. So we needed someone who was credible, respected, and had attributes that they could tackle difficult situations without instilling fear in other people and helping them to do the right thing. And the name that kept coming up was Nate Learfold, but what we kept saying was, oh, he is too busy. There is no way. If we can't ask him to take this on, he's too busy. He does too much. He's a busy clinician. He does all the education work. But his was the name at the top of the list. And we ask, and in true Tony DiBartolomeo's spirit, if you ask, Nate shows up and he'll do the job. So I think linking Nate Learfold and Tony DiBartolomeo is a beautiful thing. I think we got this right. I know that Tony would be so proud of this, and he would say, it's a great day to be a Mountaineer. So thank you for doing this. Next, I'd like to invite to the podium Dr. Arif Sawarari.
All right. Dr. Vasileki, Dr. Charlton, Dr. Ferrari, David DiBartolomeo, faculty, house staff, and friends, thank you very, very much for joining us as we recognize Dr. Learfold as the recipient of the Dr. DiBartolomeo Professorship. Dr. D was a larger-than-life figure at our Health Science Center, and I did have the privilege of learning from him, first as a resident, rotating through rheumatology, and then as a junior faculty in the Department of Medicine, embarking on my own academic career. His office was on the second floor of HSC North, not far from mine. There are many, many memories of our interactions, but one in particular stands out. It was a day or two after 9/11, and like many, I was still trying to grasp and understand the enormity of this terrorist attack. Dr. D sought me out and said, "There's going to be reaction to this attack, but you need to know that this university is a safe environment, and I want to know if you feel unsafe." This was literally like a father figure putting an arm around your shoulder and conveying that sense of safety that only a parent can. That was Dr. D for me. In similar fashion, I have seen Dr. Learfold, or Nate, take on the role of creating a safe, healthy, stimulating environment and culture for our learners. Initially as Chief Resident and Associate Program Director, then as the Program Director of our Internal Medicine Residency Program. Promoting Nate to our Department Vice Chair of Education and nominating him as the DiBartolomeo Professor were some of the easiest decisions. I wish all were as straightforward. Nate has embraced his role as our educator-in-chief. Yes, we do pay attention to curricular content, board pass rates, in-training scores, and other easier to measure markers of high-quality education program. But we also pay equal attention to well-being, work-life balance, and the sense of safety that comes with a functional family working together towards a common purpose. Nate is a leader in recognizing the importance of the latter. Now, Nate and I have quite contrasting styles. No necktie, no white coat, backpack on the shoulder are not quite my style, but they fit him. He is so effective and gets so much done by walking around, and amazingly, still manages to text and email while doing so. Last time I tried that, I literally walked into a wall and embarrassingly looked around. Nate will meet every deadline without fail. However, while to me a deadline means get this done a week before, to Nate it means I have a whole week to get it done. What also impresses me is how the final product is amazing and looks like he's been working on it for a week. We know he hasn't. Nate, we very much appreciate your leadership in the Department of Medicine. I personally am very grateful for your "how can I help" texts in response to the many curveballs we have had. Charmin, thank you very much for sharing Nate with us. He makes us a better department. Thank you. I'd like to introduce Dr. Ferrari.
Okay, thank you, Dr. Swari, for inviting me to speak a little bit today. I was asked to make some remarks actually about Dr. D, probably because I'm one of the few people left around here that had the privilege of working with him as a student, as a resident, as a junior faculty, and have him help me progress all the way to becoming a full professor during my career. I probably in fact, it is true that I probably took more rheumatology rotations as a student and a resident than any other subspecialty, not because I was particularly interested in rheumatology as a long-term career choice. I just wanted to be around Tony because he really taught all of us how to be a physician and to take care of our patients in a very genuine way. So when I think about how to describe Tony, for me, I think servant leader, friend, mentor to everyone, compassionate physician and teacher. Tony was a native West Virginian who loved this university and loved Mountaineer sports. And Judy did a great job, I think, describing his presence, in particular at a basketball game. He did the same thing at football. You just couldn't hear it quite as well as his voice booming and ricocheting in the Coliseum. Tony actually grew up in Weirton, which happens to be my hometown. And that is, I think, where he really learned his blue-collar work ethic. In fact, he was the paper boy for my in-laws. And my father-in-law frequently commented on what a good paper carrier he was, because the newspaper always made it on the porch and never got soaked in the rain. He has 2 degrees from the university and graduated in our 6th MD class in 1967. He then continued his service by serving our country in the Army during the Vietnam conflict, and that followed his completion of an internship at Walter Reed Army Hospital, which after his service in the Army, he completed his internal medicine residency at the University of Minnesota, which, for those of you that don't know, that's where the majority of the founding chairs for our School of Medicine came from. And so Dr. Flink, who was the founding chair of internal medicine, came from Minnesota. the chair of surgery, OB, many of the department chairs came to WVU from the University of Minnesota. And so I think it was only natural that they encouraged Tony to go to Minnesota to get training. And then from there, of course, he went to the University of Pittsburgh. I don't think he liked to talk about that very much, but they did actually have a good rheumatology training program. And then Dr. Flink was still the department chair and recruited Tony to come back as really the founding section chief for rheumatology. I don't know if he was the first rheumatologist in the state, but he was certainly the first full-time board-trained, fellowship-trained rheumatologist on our faculty. From the time he hit the door running, he quickly was asked to serve in many, many different leadership positions. In fact, he served as the assistant dean for graduate medical education and was the original DIO. In fact, I had the dubious honor of following him as the second DIO, but he was really the original designated institutional official for all of our residency programs. He served on the UHA board of directors. He was elected by his peers as chief of staff at the hospital. When we first developed a relationship with the health plan, he was the medical director for what at the time was called the Integrated Provider Network, which was really the regional health plan. And now, of course, you know that our relationship with the health plan has become even stronger. And Tony was not afraid to step into any leadership position the dean at the time asked him to do. How many people remember that he was actually asked to step in and serve as the chair of the Department of Pathology? Okay, a few hands went up, but not too many. I mean, think about being an internal medicine rheumatologist and being asked to chair the Department of Pathology on an interim basis. That was a very tough position because you're outside of your element of comfort. But Tony stepped up to the plate and did very well in that role. He also had a very pivotal role in the development of our relationship with the Oman Medical College, which, as you know, has continued on to this day. Within a year of his arrival, he began racking up honors and awards, one right after the other. He became a distinguished teacher in the School of Medicine, 4-time recipient of the Clinician of the Year Award, including the class of '82, which was my class, the Traubert Mentoring Award, an Outstanding Faculty Award several times within the Department of Internal Medicine. Tony made it very clear to everybody that he loved his family, and he loved telling stories about his parents, about his wife and children. And he wanted us to share stories about our families with him. And when Tony asked us how we were doing, he really wanted to know. He did not want a cursory, we're fine. He wanted a conversation on how we were doing. And if you think about it, that really was the beginning, in my mind, retrospectively now, of resident wellness in this institution. Just by asking a simple, how are you doing, and wanting a truthful, detailed answer. Nate has been involved with our education mission for a long time. Not only was he the program director for the largest residency program at West Virginia University, it's the largest residency program in the state of West Virginia. And so those are tough shoes to fill. And he built a great team to help support him so that when he was ready to move on to the next level, the residency program would go on in grand fashion and continue to create excellent internists for this institution in the state of West Virginia. Nate is also known for his compassionate clinical skills, his mentoring, and his servant leadership. And so I'm really honored to have spoken about Tony today, and I can't think of a better person to fill this role as a professorship in Tony's honor. So congratulations, Nate. Next is Tony's son, David, who I heard many stories about and we've got to know well over the years as well.
Thank you, Dr. Ferrari. Thanks for all of you for being here today. West Virginia University, WVU School of Medicine were all very important to my father. Like most native West Virginians, he felt drawn to this university and what it meant not only for the people who come here for education, but also for those with complex medical conditions who seek it out for answers, hope, and healing. As a result, he received his undergraduate degree from here at WVU, attended medical school here, returned to practice and teach here after serving his country in Vietnam. He completed his residency here and went on to his fellowship training at the University of Pittsburgh, which, by the way, I'll point out that I was too young to remember it, but supposedly he mowed the lawn in Squirrel Hill every weekend with a Beat Pit t-shirt, a t-shirt that lasted for over 30 years. Perhaps the most important part of my father's legacy is the impact he had on others. He routinely was recognized by his students, peers, state and national medical and specialty societies for his work, including being named Outstanding Teacher, Outstanding Faculty Member, and a 4-time Clinician of the Year by the School of Medicine. In that same vein, I personally think it's fitting that Dr. Lehrfold is receiving this professorship. Not only did he learn from my dad, but he too is a West Virginian, building a legacy of positively impacting others, as evidenced by him being named an outstanding faculty member, best attending physician, and an outstanding teacher. To Dr. Lehrfold and those of you who are in administrative positions, who have worked and learned from my father, know that he would be very proud of you all for what you've accomplished in the last 15 years. He would further encourage you to continue to make long-lasting and meaningful impressions on one another, your students, and the patients for whom you provide care. Congratulations, Dr. Lehrfold. We know that there are even more accolades and accomplishments in your future, and we look forward to seeing you achieve them. On behalf of my mother, my sister, my entire family, I'd like to thank you all again for being here and for continuing to carry on my dad's work. Thank you. I'd like to introduce you to Dr. Nate Lehrfold.
Thank you, David. It's very, very humbling to be mentioned in the same sentence with your dad. It's an honor to have the opportunity to play some role in taking his legacy forward. I want to thank everyone for being here today. Dr. Veselicki, Dr. Ferrari, Dr. Charlton, thank you for being part of this. Dr. Sawari, thank you for the opportunity. I also want to thank everyone who helped make this event possible, all the staff who set this up. Special thanks to Trisha Bolliard for all she's done to get me here today. Otherwise, I might not even actually be here. And or if I knew not wearing a tie today was an option, I wouldn't have worn one. So you guys have gotten to hear about Dr. D from people who knew him better and longer than me, but I do want to echo some of those remarks with my own experiences with him. So I went to medical school here starting in 1993. I started residency in 1997. I never had the opportunity to meet Dr. Flink, so I mean no disrespect when I say, to me, Dr. D was the Department of Medicine. He was the icon for me in the department. He's who I looked to. When I was an intern, my very first memory of that is our orientation picnic for the interns, which was on the family property. And as always, as he did, he made each and every one of us feel individually welcome there. As you've heard, he was a wonderful educator. He received, honestly, innumerable awards for that. I learned so much from him. He was a great clinician role model. I learned how to talk to patients, how to provide real care for patients. He taught me many clinical skills. I still remember seeing the second floor office during the rheumatology rotation as he clicked through the slides on that carousel, those old faded slides of his rheumatoid arthritis lecture. I have fond memories of those things. Remember the first time I actually could feel a joint space. I never knew how to do that till he showed me. There's tons of little things like that. Tons of advice on how to actually provide care. I think one of the ones that stands out to me was you never want to be the first person or the last person to start new therapies. So you don't want to fall for the flavor of the week, but you also want to make sure you stay up to date. And that's served me well over the years. And I can think of countless other similar things that he taught me in the same vein. He was a wonderful teacher and wonderful all those things, so many other things, but that's not what I'll remember about Tony. So for a little bit of context, I know this will be hard to picture. Very awkward intern I was. More awkward than now, if you're wondering why the comparison. I had pretty significant social phobia. For me, presenting on rounds was like presenting at grand rounds. Even with those few people there, it was very difficult for me. I would stumble so much at one point, July, my intern year on my award month, I'm presenting. And my attending at one point, Jeff Jackson, for those of you that knew him, I'm stumbling around and going blank. And he finally says, you know what, Nate? Sometimes you're presenting, it's hard to tell that you're smart. I feel like somewhere there's a compliment in there, but it didn't really feel like it that day. And like many interns, you know, I suffered from imposter syndrome. When we start out, many of us don't feel like we belong. We're not ready to be there yet. We don't know what we're doing, and someone's going to figure it out soon enough. I never felt that way when I worked with Tony. All those securities, all those things weren't there. He just had a way about him. When you worked with him, you felt seen, you felt heard, you felt like you belonged. And he did that not just for me, but for so many others. It made me a little less anxious, made me feel a bit more like I could do it. And I always remember that about him. So as I often do, I'm going to quote Maya Angelou now. People will forget what you said. People will forget what you did. But people will never forget how you made them feel. I think you've heard that theme in every single person that talked up here. I think each and every one of us remembers how Tony made us feel, and that's what I always remember about him. So I'm truly honored to be here today, to be part of moving his legacy forward. Continue to support our educational programs with a special emphasis on our rural health track and our rural scholars program, so we can keep creating doctors that take care of the patients in the state that he loved. So thank you very much.
I would now like to have Dr. Charlton come back to the podium to present the award. Wow, Dr. Lerfeld, you said it right up. There's a common theme from all of our speakers today. We all came from different directions and we all didn't know it, but we all came to the same theme. Really great, Dr. DeBartolomeo, and a really great person. Thank you, Dr. Lerfeld, for all that you do for our educational mission, our clinical mission, our outreach, teaching our students, residents, fellows, and your dedication into the profession of medicine. I'm sure Tony D is smiling right now, right there, Norm. And so thank you all for coming today. And Dr. Lerfeld already mentioned people that I wanted to mention, which are Trisha and Star and the players that helped make this happen, the speakers, and all of you. I do want to give a special shout out to any of those friends and family that helped make this endowment possible. We really appreciate your support too. So stay along, enjoy our reception, and thank you again.